This video is sponsored by Bootcamp.com. Check it out for INBDE prep and use coupon code MENTALDENTAL for 10% off. Hey everyone, Dr. Ryan here, and welcome to the final video of our ethics series. These are the 7 videos before this one where I covered the ADA Code of Ethics, talked about the 5 ethical principles, and specific examples of how they're applied in dentistry. If you haven't already, I definitely encourage you to go back, watch the full series before attempting the practice questions in this video. And after you've done that, it's time to put your knowledge to the test. I put together 15 practice questions for us to go through together, and these will be identical to what you see on test day. So I want you to keep track of how you do and let me know in the comments once we're all done. Okay, so let's get started with question number 1. While extracting a maxillary molar, you lose a root in the maxillary sinus, which cannot be retrieved at the moment. You do not inform the patient of the incident. Which ethical principle did you violate? So go ahead, pause the video, think through this question, and then we'll go over it together. All right, so you'll get a lot of ethics questions on your board exam, and a lot of them will be set up exactly like this one, where there is some incident that took place, and you'll have to determine which of the 5 ethical principles was violated. So to quickly review, we have autonomy, which is self-governance, nonmaleficence, which means do no harm, beneficence, do good, justice, fairness, and veracity, which is truthfulness. So in this case, we took out a tooth, a root was lost, and we didn't tell the patient what happened. Lying to the patient about an outcome of their dental treatment, or in this case, lying by omission, not telling them what actually happened, is a violation of representation of care, which is part of the Code of Professional Conduct under Veracity. And this makes sense because lying, of course, would be a violation of truthfulness. I want to clarify this though. The word inform can be a little bit tricky because if you remember from our autonomy video, we talked about informed consent. So the timing of this is very important. Since treatment already commenced and we lied about the outcome, that's a violation of veracity. If we failed to inform the patient of treatment details before treatment has commenced, that would be a violation of autonomy. For example, if you never described that a broken root tip is a potential side effect of tooth extraction, you would be violating autonomy because you didn't properly inform the patient and they couldn't make an informed decision for themselves whether or not to proceed with the extraction in the first place. But in this case, the answer is E. Question number 2. The dentist started making an impression but did not disclose that she's getting paid from a dental supply company for trying their new impression material. Which principle of ethics did she violate? Go ahead, pause the video, think through this question, and then we'll go over it together. So here we have another principle violation question. And once again, we have to figure out what concept is being tested here. So we have a patient who wants a new partial denture. The dentist is making an impression for that new denture. And there's nothing wrong with using a new impression material. The problem is she didn't disclose that she's getting paid for using it. So there's a conflict of interest there. And the disclosure of conflict of interest falls under veracity. We have to reveal any monetary or special interests during presentations in articles and, as we see here, in the clinic as well. So the answer for this question is E. Question number 3. Which ADA principle of ethics promotes the concept that the dental profession should actively seek allies throughout society that will help improve access to care for all? Go ahead, pause the video, think through the question, and then we'll go over it together. Okay, so where the last 2 questions were asking us to remember which part of the Code of Professional Conduct was being violated, this question is testing your understanding of the actual principles themselves. The key word in this question stem is right here at the very end. All. Wanting to improve access to care for all people. We have to be really careful here because it would be easy to convince yourself that this relates to beneficence, doing good, maybe participating in community service. But this is not beneficence. Beneficence is more focused on promoting the welfare of each individual patient, whereas justice is about delivering dental care without prejudice and improving access to care for all people. And that's word for word from the ADA code. So the answer to this question is D. Question number 4. The previous dentist did not finish the treatment plan for this patient and did not notify him that treatment would be discontinued. What ethical principle did the dentist violate? Go ahead, pause the video, and then we'll go over this question together. So we see a patient here who has multiple untreated carious lesions that need to be treated. And not only did the previous dentist not treat all of his cavities, but they also didn't notify him that treatment would be discontinued. Abruptly ending a treatment plan before it's been completed without giving the patient adequate notice and opportunity to find a new dentist is called patient abandonment. And this one is included as part of non-maleficence, since leaving a patient to fend for themselves without a treating dentist would be doing harm to them. So the answer to this question is B. Question number 5. A patient wants a fractured tooth extracted. The dentist tells the patient that the fractured tooth is restorable. What two ethical principles are in conflict here? Go ahead, pause the video, think through this question, and then we'll go over it together. Okay, so the patient wants a fractured tooth extracted. That is the patient's decision, respecting their autonomy, their own right to self-determination. The dentist tells them, though, that that fractured tooth actually can be saved and restored. That falls under beneficence. The dentist is trying to do good and provide competent dental treatment that may benefit the patient in the long term. So the two competing principles are beneficence and autonomy. As an aside, these are the two principles that tend to be in conflict with each other most often. I'll give you another example just to really drive this point home. If you have a patient where you suspect abuse may have occurred, but they're an adult and can make their own decisions, you have the patient's confidentiality or autonomy competing with beneficence, which would be reporting the abuse. So similarly here, we have beneficence and autonomy in conflict, so the answer here is A. Question number 6. Which principle of ethics is associated with reporting this patient's rash? And you'll have to read more from the patient box. So go ahead, pause the video, and then we'll go over this together. Okay, so we have a patient who got a bad rash from an antibiotic that was given to her last time. We see penicillin in the medications list, and we also see that confirmed here that the patient was given penicillin after an incision and drainage procedure was done. So this patient had a bad rash from taking penicillin, which we would consider an adverse reaction to medication. Reporting adverse reactions to the FDA falls under devices and therapeutic methods, which is part of the Code of Professional Conduct from Veracity. So the answer to this question is E. Question number 7. Which component of the ADA code is legally binding to all dentists globally? Go ahead, pause the video, think through the question, and then we'll go over it together. Okay, so I have to apologize because this is a tricky question that I wrote here. It's true that the Code of Professional Conduct is the only section of the ADA code that is legally binding, but that's only true for members of the American Dental Association, Not all dentists in the US are automatically members of the ADA, and certainly not all dentists globally are members of the ADA. So while the ADA code provides excellent guidelines for all dentists, only members of the ADA are legally bound to the Code of Professional Conduct. So for this question, how it's written, the answer is D. None of these three features of the ADA code are legally binding to all dentists in the world. Question number 8. What ethical principle allows the legal guardian of a patient to speak on behalf of the patient? Go ahead, pause the video, think through this question, and then we'll go over it together. For a minor under the age of 18, informed consent is required from the parent or legal guardian since the patient cannot legally give consent. The only exception to this is emancipation, which is granted for minors who are married, pregnant, a parent, or serving in the military. But this concept of informed consent falls under patient involvement, which is part of the Code of Professional Conduct for patient autonomy. So the answer to this question is A. Question number 9. How should you manage this situation? So go ahead, look through that patient box for clues, think through the question, and then we'll go over it together. Okay, so this question harkens back to the abuse and neglect video. We have a pediatric patient, and we have 2 red flags that raise suspicion of abuse. First, we have bruises on the stomach and an aggressive parent trying to hide the injuries. So if we go to the answer choices, we shouldn't ignore these suspicions because we're legally, morally, and ethically obligated to report suspicions of child abuse. And we also don't need to ask for more information because we're already suspicious. Now, we're not 100% sure that abuse has taken place, but remember, we don't need to be. So once we're left with C and D, the question becomes, what's the proper order? Should we call Child Protective Services first, or should we call them after you finish treatment? Remember, the proper order is recognize, report, record, then render treatment. So D is incorrect because reporting should happen before treatment is rendered, not after. So the correct answer to this question is C. Question number 10. In the ADA code, the principle of justice deals with each of the following issues except one. Which is the exception? Go ahead, pause the video, work through this question, and then we'll go over it together. So this one tests our knowledge of the codes of professional conduct under the principle of justice. That principle includes patient selection, not refusing patients based on characteristics, disabilities, or diseases, emergency service, being available after hours for urgent care needs, justifiable criticism of colleagues performing continual faulty treatment but without slandering them, expert testimony, providing a testimony as an expert witness without having a vested interest in the case, and finally, not offering or accepting rebates and split fees, which isn't one of the options here. So after running through our list, we have one that remains, second opinions, which is part of consultation and referral, which falls under the principle of non-maleficence, not justice. So the answer to this question is D. Question number 11. The patient reports that she's covered under dental insurance, so you decide to increase the fee of endodontic treatment solely for this patient. Which ethical principle are you violating? Go ahead, pause the video, work through this question, and then we'll go over it together. All right, so we're back to the violation of ethics questions. Increasing the fee for a patient just because she's covered under dental insurance is called overbilling. Lying about your fee schedule would be violating your ethical obligation to be truthful and honest to your patients. Overbilling falls under representation of fees, which is part of the Code of Professional Conduct for Veracity. So the answer to this question is E. All right, question number 12. What ethical principle did the dentist down the street violate by making that comment? And you'll have to go to the patient box for more information on this question. Go ahead, read through that, think through the question, and then we'll go over it together. Okay, so hopefully you're starting to get the hang of these violation questions. It's all about memorizing the Code of Professional Conduct for each of the 5 ethical principles and then just applying it to each patient case. For this one, we're talking about slandering another dentist, which falls under justifiable criticism, which is part of the Code of Professional Conduct for Justice. Now, if that other dentist down the street just said, you have an open margin on this crown, and depending on severity, we can either monitor it or replace it, they went after the actual dentist and said their work was very poorly done. That would be considered slander, which would be a violation of justifiable criticism. That is unfair criticism, thus a violation of justice. So the answer to this question is D. Okay, question number 13. Each of the following statements concerning the informed consent discussion is true except one. Which is the exception? Go ahead, pause the video, think through this question, and then we'll go over it together. Okay, so for the informed consent discussion, the patient must absolutely have the opportunity to ask questions about different treatment. That is true, so B is out. The conversation does not have to include cost of proposed treatment. That's true. What it does need to include are risks, benefits, and alternate treatment options. So that is out as well. Speaking of which, option D says potential risks and benefits of treatment should be included, which is true. The informed consent discussion must be held between the dentist and the patient, not an administrative staff member. Having that conversation establishes rapport and a dentist-patient relationship built on trust, upon which all of these ethical principles function. So the answer to this question is A. Question number 14. The patient behaves rudely and abusively to your front office staff before the examination of this patient's initial visit. The patient does not correct his behavior after being asked to do so. Under which ethical principle would it be reasonable to refuse to see this patient? Go ahead, pause the video, think through the question, and then we'll go over it together. So the patient is rude and abusive to your staff. The first question is, can you rightfully dismiss them or not? Here we have a non-emergent new patient who behaves abusively to your front office staff, and the patient does not correct his behavior after being asked to do so. In this case, it's perfectly reasonable for you to elect not to accept the person into your practice. Now, this assumes that the person's abusive conduct is not associated with a disability, because we can't discriminate someone because of a disability. But the Code of Professional Conduct for Patient Selection states that we have reasonable discretion in selecting patients. And this is a situation where you can absolutely use your discretion whether or not to see this patient. Since patient selection falls under justice, the answer to this question is D. It would be reasonable to dismiss this patient under the ethical principle of justice. And the last question, question number 15. As a dentist, you are obliged to keep your knowledge up to date and learn new technology under which ethical principle? Go ahead, pause the video, and then we'll go over this together. So keeping your knowledge and skills updated through continuing education and other means is part of the Code of Professional Conduct for non-maleficence. Remember, we have an obligation to keep our knowledge and skills current so we do no harm to our patients. The answer to this question is B. So I hope that was helpful, and as you can see, the ethics section is fairly straightforward. It just requires some memorization for each of the ethical principles, and as long as you have a good handle on what's included under what principle, you'll get every ethics question on your exam correct, which will give you a lot of points toward your pass. Again, let me know how many you got right in the comment section, and I'm wishing you all the best as you continue your studies. That's it for this video. Thank you so much for watching. Please like this video if you enjoyed it, and subscribe to this channel for much more on dentistry. If you'd like to support me, please check out my Patreon page. And thank you to all of my patrons for their support. You can unlock access to my video slides to take notes on and practice questions for the board exams, so go check that out. The link is in the description. Thanks again for watching, everyone. I'll see you in the next video.